So I thought what I'd do is share some recent work that we've been doing linked to a randomized controlled trial of the SASA intervention in Uganda, and particularly a piece of work that was funded by Van Leer Foundation to really say, well, actually, if we're impacting on levels of partner violence in a household, could that have benefits for kids? And we all know this. There are multiple development pathways. The sort of different forms of violence that different people around this room work on are very interconnected. But as a field and as a way that when we think about interventions, and I think that was highlighted in the plenaries this morning, we often look at it through our own particular lens. And I'm somebody who's very much falls into that camp. You know, I do trials I measure the prevalence of violence. I do trials to say, can we impact on levels of domestic violence? And you know, I just sort of look at this lens. So within this picture here, we're working at the levels of partner violence down the end and saying, can we impact on that? But I think the important question for the field and thinking about how do we address violence as a broader phenomena is to say, well, is there a feedback loop and a direct feedback loop into what's happening in the kids of those families that we're working with lives? And so that's what I'm going to share some findings in relation to that. In particular, trying to think about, given we have these connections, and actually given the many sort of forms of core skills that different programs are trying to develop, are there potential synergies? And if there might be those synergies, how as a field do we really draw out those synergies in future programming and investment? And so the questions for me, coming from a partner violence field is, well, firstly, we know a lot of women who are experiencing partner violence have a history of abuse in childhood. Do our partner violence prevention interventions actually, are they effective for them? Or do they have a deeper history of exposures to violence that actually means our sort of norm change, skills building interventions actually might not be effective? The other question I think that's interesting is, actually, if we're changing men's behavior in the household so they aren't being violent towards their partners, does that mean they're also not violent towards their kids? And lastly, a lot of what we measure in partner violence intervention work is actual use of physical or sexual violence, but also more broadly, if you're changing the dynamics in the household, could that also impact on broader parenting behaviors? So these are the sort of issues I'm going to try and tease out in relation to the evaluation study that we did in Uganda. So, the SASA intervention is the study that I'm going to talk about. So this is a complex community mobilization intervention that is a phased intervention that tries to say, can we move a community through a process of change? It's implemented by voluntary community activists, both male and female, who are recruited from the community. And then what the intervention does is support those activists as well as religious leaders, other key stakeholders in the community, to start talking and interacting with the community to think about power and the misuse of power. So all of the discussions are framed about power, and to support communities to start thinking critically about what are ways that people might use power positively or negatively. From that emerges discussions around gender, around partner violence, around other forms of violence in the community. As part of that intervention, in the later phases, the intervention supports the development of skills around communication, around conflict resolution, promotes joint decision making, and also non-violent ways to resolve situations of conflict and to manage anger. And actually Nambusi is sitting in the back quietly, is a co-author on this and has a nice poster, number 15, that tells you more about the SASA intervention and the findings as well. And she's the lead qualitative social scientist on the SASA trial that I'm describing to you. So to talk in a bit more depth about the approach, the SASA is an acronym for these 4 phases: start, awareness, support, action. The first phase is supporting activists. Then the intervention support those activists to develop confidence and to engage with the community. It then supports community members to reach out to other community members, talks very much from a power framework about how do we have power together to address the issues that our community faces. And lastly, in the action phase, is saying how do we try and institutionalize those behaviors that people are trying out, and how do we get the structures that are meant to serve the people actually work to serve and support nonviolent behaviors. And this is an intervention model that's being developed by Sigrid and Rausing Voices, which are the local implementing partners, over many years of trial and experience, drawing on a range of different theories. So it's very much a theory-based intervention that's been well established in this community. The critical thinking and the way that this intervention works is that it's saying we recognize change isn't a one-off thing. We don't go and preach and say violence is bad and expect everybody to stop violence, but say how do we support people to go through a process of critical reflection and to sort of explore ideas and behaviors. Another important aspect is trying to change communities, not individuals. So it's saying how do you think about delivering interventions that actually have reach, that you aren't solely focusing on working with a small group of individuals intensely, but saying how do we try and get reach across a community, and how do you use a range of different strategies to get that sort of coverage that we know is probably what you need to achieve change. And then lastly, in terms of content, it's very much focusing on the use of power rather than talking about gender, because men have been disempowered. Men can identify with the notions around power. Well, if you talk about women's rights or you talk about gender, men turn off. And you know, most people don't want to go to a discussion around gender. So in terms of an overview of the study that we've completed, we did a cluster randomized controlled trial with 4 intervention and 4 control clusters, about 2,600 respondents at follow-up. We had complementary qualitative research, we did operational research, and we did a full economic costing of the intervention. The design was cluster randomized design, very small, so 4 intervention and 4 control communities, baseline in 2008, follow-up in 2012. That's 4 years, but in the end the program did about 2.8 years of programming, active programming, because there was a lot of political unrest, there was a lot of localized violence linked to elections. So there are some times when you couldn't hold a group meeting, it was seen as politically threatening, and that was banned. So it's sort of in a way the context, not as bad as the context you're working in, but ongoing challenges around how do you deliver interventions in somewhat unstable settings. From our comparisons, it looks like the intervention and control communities were highly comparable. So in terms of the scale of activity that was happening, there were about 400 activists supported by the intervention over this time. They were trying to count activities. It's roughly 11,000 activities were documented, reaching over 260,000 community members. So what we did in the trial is not measure, does this intervention have an impact amongst people who've directly experienced the intervention, but do we see an impact actually in the community as a whole? And this is really the first trial that has said, can we, in sub-Saharan Africa, say, can we achieve an impact at a community level versus amongst the direct recipients of an intervention? This slide shows the levels of coverage that the intervention achieved. So these are intervention communities. These are our control communities. I'm showing the control because it was a social mobilization intervention, so our big worry was actually that we could have contamination, but we don't seem to have much evidence of that. Pretty good coverage of the intervention, high levels of exposure to a sort of moderate level of intervention activity, 85% for men, 53% for women. It's generally a bit harder to reach women than men in these communities. Okay, so just to give you a summary of the overall intervention results, and this is results that have recently published in PLOS Medicine. So for people who want to look at the technical detail, I'd encourage them to look at that paper. But basically, we had a number of primary outcomes for the trial that were developed on the theory of change for the intervention. So we had, and these were all focused on partner violence. So these are, and HIV-related risk behaviours. So the intervention is a sort of violence and HIV program. So I don't know if you can read it at the back, but these are all ones about, this is the acceptability of physical violence by men and women. There's the acceptability that women can refuse sex, and this is the appropriateness of community responses amongst women who've experienced partner violence in the past year. And these are the effect sizes. We hypothesized all of these would move to the right. They all moved to the right, with most of them being significant. And the community response one having wide confidence intervals, basically because we're applying our analysis to a small number of women who'd experienced violence in the past year. When we look at the levels of past year physical violence, we have a 52% reduction in partner violence. We have confidence intervals that cross 1, and that basically relates to that we have a small number of clusters, and at follow-up we had a lot of variability in our intervention clusters, so that limited our statistical power. But a big effect size going in the hypothesized direction, and a smaller reduction on sexual violence, and then significant reductions in reported sexual concurrency reported by men. And a lot of consistency across those outcomes. Okay, so that's the trial, that's the main thing that study was designed to look at, and it all looks very positive, it's all working in the way we hypothesized. So then moving on to, well, what do we know about what was happening with kids? So I think the first thing is that actually, if we think about those pathways, that we have a 52% lower levels of partner violence in our intervention and control than in our control communities is really important, because we've got an average family size in Kampala of 4 kids per household. So you've got 4 kids per household now who are not seeing violence in their household. So that direct witnessing of violence has gone down because we've reduced partner violence. And actually these are the technical numbers related to that 52%. When we go on to look at, well, what's happening in households where there was violence in the past year, and what was interesting and I hadn't expected was actually this is in our intervention communities and this is in our control communities. This is the blue is the percentage of children that were present, that women reported were present when there was partner violence. And so we're seeing a really big difference between our intervention and our control communities. So even when there's violence happening, children are seeing it less. And that's we think a consequence of a couple of things. We're seeing even where there is violence, that violence is less frequent, so there's less chance that the kids are exposed, but there's also an awareness that actually this is a bad thing that's happening and maybe the kids shouldn't be exposed to it. The next question that I asked about is, well, we know women have a histories of violence. My fear is that when we do our partner violence prevention programming, maybe it doesn't work for those women with a strong history of abuse. So to give you a sense, in our study communities, these are the prevalence of different exposures to violence in childhood reported by men and women. So this first one is witnessing violence in their own families, it's being badly beaten, and touched sexually against their will or made to do something sexually against them. And high levels, slightly higher levels for males and females of these two, and then higher levels of sexual violence against women than against men. So then when we disaggregate our data on women's experiences of violence by whether those women have a history of violence or not, and look at our intervention and control communities, we're seeing lower levels of violence in our intervention than our control, which is what I've shown you before. We're still seeing this differential. This is in our control, so we're seeing higher levels of violence amongst women who have early life experiences of violence versus those who haven't had those early life experiences. We are seeing reductions in both categories as a result of our intervention. Now, we haven't gone on to do more sophisticated analysis on this. We're going to go on and do that. So this is very much just look at the raw data and give you a ballpark figure. But that's something that we're going to go on and interrogate a bit more to say, well, do we see differential effects, or actually could our partner violence prevention programs work equally well irrespective of your history of abuse? And lastly, moving on to the qualitative data, and this is really slides that Nambusi sent me, and I probably won't do justice to, so if you can chip in at the end. But there is some suggestion from the qualitative data that SASA is influencing parenting, that that it is, the sort of qualitative data is suggesting that there is some improved quality in the parent-children relationships, and particularly in terms of communication and connectedness. There's evidence that parents are becoming more aware of how their words may impact on their children. So this is one about, as a mother, I can no longer call my child stupid if he goes to school thinking that his mother thinks he's stupid, how can he perform? And there's also some evidence that parents were involving children in decision making more than they would have previously. There also is some suggestion from the qualitative data that the intervention may have impacted on parents' use of corporal punishment. And again, in a few cases from our qualitative data, parents were talking about, because they'd rejected violence, they'd also rejected it in relation to disciplining their children. And also as part of that the intervention had given them skills so they didn't have to resort to corporal punishment. Because part of the intervention does support the development of skills to reduce conflict, that was translating into how they might respond to problems in the household. And then where the parents still said that they use corporal punishment, there also seemed to be some evidence of a different dynamic. So warning children about that there's an issue and there might be consequences, and so really violence is being more used as a last resort versus out of a lack of control. And then at the community level, some evidence that there was a lack of sort of reduction in social tolerance to the use of violence against children. So this is a quote: "If I saw my neighbour using violence against her child, I would not hesitate to intervene or be quiet on this one. Even if you were my friend, I would come to you." So that's a sort of snapshot of the data that we've really done in a sort of secondary way after completing the trial to say, well, what might be happening with kids? If I think then about the connections between preventing partner violence, preventing violence against children, I think there's three main elements. I think the first one is the direct impact. So a lot of relationships start before age 18. They're children in intimate partnerships. So actually by impacting on intimate partner violence, we're impacting on violence against children if we use the 18-year cutoff as a definition. So there's that direct partner violence programs prevent violence against children. I think the second is what this data is suggesting is that they have the potential to also improve household functioning, and particularly the sort of non-violent parenting approaches for parents, and really that the skills that a violence prevention program is developing actually also the skills you need to be a good parent. And the question I didn't manage to ask this morning to Teresa is, in the programming they're doing around children, could that happen the other way? And actually, are we all working towards developing a core set of skills that are applied to in relationships or to kids? And lastly, we have the pathway through, by reducing the prevalence of partner violence in children's household, we're reducing the kids' exposure to violence, which has downstream benefits in terms of future levels of violence. And then lastly, in terms of conclusions, I think it's this issue about, as we move forward in the field, is sort of moving between packages and separate models of intervention to start to analyse across different forms of violence what are the critical elements and skills that we're trying to build. In this case, what SASA does is it tries to support critical thinking and analysis. It aims to be aspirational. It's saying, what do you want to be, what kind of relationship do you want? What kind of interactions with your partner do you want? Similarly, I think that's what's happening with the programming with children. And it supports the development of new skills of interaction and non-violent conflict resolution. So for me, this has been a bit of an eye-opener, going back and looking at our data and thinking about this, in terms of actually that we really need to be thinking much more carefully about the multiple potential benefits of effective violence prevention programming. We need to be learning much more effectively across fields about how do we translate lessons across different forms of violence prevention. And then trying to think about what might be the next generation of programming where we actually draw those insights together, and so say we're intervening at a community level to really impact on partner violence and violence against children. And this is critical because actually to make an economic case for investing in violence prevention, we aren't going to win it by going, oh yeah, and you have to do this form of violence and this form of violence and this form of violence and this form of violence. We've really got to get a joined up thinking about costs and effects. And particularly if we're saying let's implement new interventions at a community level, the economic argument is that it creates multiple benefits. It's not single benefits. So for us, in every future trial that we do on measuring the impact of partner violence, we'll now measure violence against children. I feel embarrassed that I've been working in the field for 15 years and have never done that before. I also hope similarly for those people who work on violence against children, they'll start looking at does this improve relationships and partner violence. And that's how we're going to speed up learning and synergies across our fields. So I'm going to end there. Thanks.